Hey, Jim Hoffman, and welcome to another episode of the EMS Green Room. Today, I want to talk about something that I just love when patients do. When you ask them what their history is, and they answer with things like, "What don't I have?" or worse, "I don't have any." And that's only come to find out that they have a laundry list of problems and medications to go with them, and they give them to you in little piecemeal sort of segments. And this can be frustrating for any provider at any level, whether you're an EMT or a paramedic. So the question you ask, what medical history do you have, shouldn't really be met with a sarcastic answer from them or blown off as it doesn't matter, okay? Because you and I both know that it does matter when we're trying to find out what's happening with them or we're trying to document appropriately for them. So I still find myself falling into this trap over and over again as much as I try to avoid it. So what I've been trying to do is rephrase my questions as much as possible to not give them that opportunity to answer that way or to misinterpret it as an opportunity for them to kind of joke about their medical history or deem it not important for why they called 911. So now I ask things like, so tell me, has your doctor told you you have any significant medical problems? Something like that. Or when I take their blood pressure, I look at them with a serious face. I say, do you have high blood pressure or heart problems? And I kind of do this without telling them what I got on the blood pressure, so it kind of makes them think that there's a very important reason why I'm asking a question like that. And plus, this kind of opens the door to other medical problems that they may have as well. Now, another question I ask is too is, do you take medication for anything? Now, I know this might kind of open me up for a similar response I'm trying to avoid, but I think it does give a little bit more direct way to get them to answer, and I think it makes them have to think a little bit, not to be so quick to give a brush off sort of an answer when I'm saying for anything, so you can let them know that this might be a reason why I'm asking them if they're taking any medication for anything at all, whether it's blood pressure or maybe just some sort of a vitamin they're taking. So kind of let them know that there's a reason why I'm asking why they're taking any medication. So I'm gonna let you know how this kind of works out for me as we go on. So far, it's been a little bit better for me. I've been doing this, for the past year or so and trying to get out of that habit of, asking questions like, what kind of medical history do you have someone say, oh, what don't I have? Or kind of joke about it. So I'll let you know how that works out. But in the meantime, let me know what you do, how you sort of avoid this sort of response from patients when you ask them questions. I'd love to hear how your take is on it and how you avoid extending the patient interview longer than it has to be when you're trying to figure out what's going on with your patient and how to treat or transport them. So let me know what you do. And until next time, of course, I am Jim Hoffman for EMS SEO. Stay safe.